A separated shoulder typically refers to a disruption or injury to the small joint on the top of the shoulder called the acromioclavicular joint. That's basically where the collarbone or clavicle attaches to the upper part of the shoulder blade called the acromion. Usually this joint is injured with a direct fall onto the point of the shoulder or with the arm outstretched. It's a very common injury in contact sports, football, hockey, sometimes in basketball, but the two main ones are football and hockey. The athlete or the person will present usually with swelling across the top of the shoulder, pain reaching across their body or overhead. Occasionally you'll see a bump in the shoulder and even drooping if it's a major separation. Diagnosis of a acromioclavicular separation is usually done radiographically, at least to determine how severe it is. Clinically, it's fairly easy to diagnose because their pain is located right at the top of the joint. It's superficial, just under the skin, so you can push on that area, and if that's where their pain is reproduced, then you know the symptoms are coming from an AC joint. If it's a mild sprain, you may not see any swelling or any bulging at that joint. If it's a more severe sprain, sometimes the collarbone can be sticking up to the point where it almost pokes out of the skin. That's fairly easy to diagnose. We then get an x-ray and check and see the alignment of the collarbone relative to the shoulder blade. Frequently we'll compare that to x-rays from the opposite shoulder to make sure that the spacing between the coracoid and the clavicle are different, and that helps to diagnose a sprain to that area as well. Depending on which one of the ligaments are torn and how badly they're torn determines the severity of the sprain to that joint. It's graded anywhere from a 1 to a 6, with 1 being the least severity and 6 being the most severe. A treatment for a separated shoulder depends on how severe of a sprain or separation there is. With the mild grades 1 and 2, which is basically just a slight displacement of the collarbone relative to the shoulder blade, we can treat that non-operatively with just symptomatic treatment. Ice over the AC joint, anti-inflammatories, starting to resume motion, and once that person's strength is back, they have full range of motion of the shoulder, we can get them back into sporting activities. The more severe separations a lot of times require surgical repair, and what we're trying to do is reattach or at least reapproximate the collarbone to the shoulder blade and allow the ligaments to heal. We can do that through various methods. We can use screws, we can use sutures, a device called a tightrope is sometimes used, or we can actually use harvested ligaments to rebuild the ones that have been torn and reconstruct those strong supporting ligaments between the coracoid and the shoulder blade to help to stabilize that. After that, typically it requires about 4 to 6 weeks of not doing any heavy lifting, allow some of the ligaments to heal in, and then gradually starting to resume physical therapy, strengthening the shoulder, and back to full activity.